1. A punched-out edge is a characteristic of which type of ulcer? A. Tuberculosis. B. Rodent ulcer. C. Syphilitic. D. Non-specific ulcer. E. Malignant ulcer. Ulcer is the break in the continuity of epithelium of skin or mucous membrane. On the basis of edge, it is classified as sloping edge, seen in healing ulcer; punched-out edge, seen in syphilitic ulcer and deep tropical ulcer; undermined edge, seen in tuberculosis; raised edge, seen in rodent ulcer; rolled-out edge, seen in squamous cell carcinoma. So option C is correct. 2. Following facial injury, nasal secretion can be differentiated from CSF rhinorrhea on estimation of A. Sodium. B. Glucose. C. Potassium. D. Chloride. E. Urea. Option B is correct. CSF rhinorrhea is a leakage of cerebrospinal fluid from nose, and it can be differentiated by nasal secretion by that it cannot be sniffed back, and sweet in taste due to glucose, while nasal secretion are salty in taste. 3. Cystic hygroma is A. Lymphangiectaria. B. Cavernous hemangioma. C. Sebaceous cyst. D. Dermoid cyst. E. Hemangioma. Option A is correct. Cystic hygroma is a multiple local cystic masses lined by endothelial cell, caused by sequestration of jugular lymph sac from a lymphatic system, and filled with clear lymph. It is associated with Turner syndrome. 4. Usual fluid requirement in burn patient per kg % burn during first 24 hours is A. 3 to 4 milliliters. B. 5 to 6 milliliters. C. 7 to 8 milliliters. D. Greater than 10 milliliters. E. Greater than 20 milliliters. Option A is correct. 3 to 4 milliliters. 5. In a patient with pneumothorax and circulatory collapse, the first action should be A. Immediate X-ray chest. B. Oxygen inhalation. C. Insertion of chest drain, needle. D. Tracheostomy. E. Putting the patient on ventilator. Option C is correct. Insertion of chest drain/needle. 6. The most common indication for removal of sublingual salivary gland is A. Silodinosis. B. Neoplasm. C. Ranula. D. Lymphoma. E. Stone. Option C is correct. Ranula. 7. The major cause of death following road traffic accident is A. Brain damage. B. Abdominal injury. C. Facial injury. D. Chest trauma. E. Fracture with fat embolism. Option D is correct, chest trauma. 8. Cleft palate repair is ideal at the age of A. 6 months. B. 6 to 18 months. C. 12 to 24 months. D. 2.5 years. E. 5 years. Option B is correct, 6 to 18 months. 9. Dentigerous cysts develop around A. Root. B. Gingival margin. C. Crown. D. Mandible. E. Gum. Option C is correct. Crown. 10. In tongue cancer, the site least affected is A. Lateral margin. B. Ventral surface. C. Dorsal surface. D. Tip. E. Posterior portion. Option C is correct. Dorsal surface. 11. Ameloblastoma most commonly occurs around A. Incisors. B. Premolars. C. Canine. D. Third molar. E. Second molar. Option D is correct. Ameloblastoma. 12. Subconjunctival bleed with no posterior border indicates fracture of which bone? A. Maxilla. B. Mandible. C. Zygoma. D. Nasal. E. Skull. Option C is correct, zygoma. 13. The weakest part of mandible where fracture occurs. A. Neck of condyle. B. Angle of mandible. C. Canine fossa. D. At the infected wisdom tooth. E. Midline. Option A is correct, neck of condyle. 14. The most common fracture of face is that of A. Mandible. B. Maxilla. C. Zygoma. D. Nasal bone. E. Orbital bone. Option D is correct. Nasal bone. 15. Cleft lip ideally repaired at A. Soon after birth. B. 6 weeks 12 weeks. C. 10 weeks minus 24 weeks. D. 24 weeks 36 weeks. E. 1 year. Option C is correct, 10 weeks to 24 weeks. 16. The danger area of face wherefrom infection can spread directly to cavernous sinus includes A. From below the eyes up to chin. B. Area around the lips. C. Area around lips including lower part of nose. D. Whole of the face. E. From maxillary sinus. Option C is correct, area around lips including lower part of nose. 17. Gillies approaches for reduction of A. Blowout fracture. B. Nasal bone fracture. C. Zygoma fracture. D. Mandibular fracture. E. Orbital bone. Option C is correct, zygoma fracture. 18. Oral melanoma though rare commonly involves A. Alveolus. B. Floor of mouth. C. Hard palate. D. Tongue. E. Soft palate. Option C is correct. Hard palate. 19. Carcinoma of the lower alveolar ridge occurs around A. Incisor. B. Canine. C. Molar. D. Angle of mandible. E. Premolar. Option C is correct, molar. 20. Sinus disease is best demonstrated by A. CT scan. B. Plain X-ray. C. Tomography. D. Ultrasound. E. MRI. Option A is correct, CT scan.